Hi, I'm Dr. Robert Graper, and I'd like to explain how we do 21st century breast augmentations at Graper Cosmetic Surgery. After we do a complete consultation where we hear what a patient would like to achieve, we examine her, give her options, all patients want to know what they can look like, and now with the Vectra technology, we can show them what they're going to look like. So using this Vectra 3D high-resolution camera, a patient will stand right here. They'll get a picture from all three different camera angles, and then the software in the computer will meld those images into a high-resolution image that is 3D, and we can rotate it in any direction in space and show them what different size implants can look like, so that it takes the guesswork out of knowing which size is best for them. So let's look at a few of those images. These are all 3D animations given to us by the Vectra company, and let's choose this one and just see what it'll do for us. So here's an example of a patient, a sample patient in 3D high resolution. We use this imaging system to determine specific landmarks. We then analyze those landmarks to assess any asymmetries in shape or size, and you can see it's a very detailed system. Once we have identified those issues and discussed them, we can go to the fun part of selecting implants. This particular patient wants to be a C. A reasonable starting point would be a 300 cc implant. We can choose any style implant we want. This particular style will be an Allergan high-profile round smooth gel implant, but we could use the new highly cohesive implants, the so-called gummy bear implants, or even saline implants. So here's a patient that has the 300 cc's added to her natural size, and we're going to view the results compared to where she started. So here she is on the left side, pre-op, and you can see there she is from the side view in her anticipated result in 3D high definition. You can see the cocktail view of what she would look like. We can come around and see the bottom view, side view, or any view we'd like to see. Say the patient's not sure that that's exactly the size. Maybe she'd like to go a little bigger. We can go back to the selecting implants. We can choose a different scenario and put in a different size implant. The computer will generate that image. And as we watch, they appear. We can then view all three results simultaneously. This is her pre-op image. Here's a 300 cc implant. Here's a 400 cc implant. And she can look at in all views and try to determine what's her best option. Once we've done this, we can send these pictures to her in a PDF format that I'll demonstrate. In this type of scenario where this image is sent online, and we can show several different styles or sizes in this image as well. So the patient, when they leave Graper Cosmetic Surgery, has all the clinical and photographic information they need, as well as the administrative information to make a good decision. And that's how we do breast augmentation consultations at Graper Cosmetic Surgery in the 21st century.